Good morning, everyone. Welcome to Nutrition for Colorectal Health. We're doing a special session today in anticipation of the crew walk on June 23rd. Hoping to see everyone there. So today we're going to talk about colorectal health and how we can reduce our risk for cancer, for colorectal cancer. So I'd like to see what you already know. So I'm going to launch this poll. So if you can take a moment to answer these three questions. We're not going to go over them now. We're going to go over them at the end of the presentation. So one, more than 60% of colorectal cancers can be prevented in the United States with screening. Is that true or false? Two, fiber feeds the good bacteria in your gut. True or false? And stool-based testing that is completed on an annual basis is an effective screening tool for colorectal cancer. True or false? So if everyone can take it, that would be great. Okay, I'm going to end it, and then we'll discuss the answers at the end of the presentation when we do the post-test. So the information contained in this presentation is not a substitute for a medical consultation. So you should always consult a physician if you have any health problems or medical conditions. I'm not a doctor, I'm not a nurse, so I don't talk about specific health conditions or treatment for if you have something. So my goal today is that you'll understand the different risk factors for colorectal cancer, take all of that great nutrition information that you'll learn today and apply it to promoting your own colorectal health and reducing your cancer risk. And most importantly, to encourage yourself, your friends, and your family to seek appropriate cancer screenings according to all the different guidelines. So let's talk about the colon. So the colon's made up of several different parts. And it starts on the right-hand side of the body where the small intestine connects to the colon at the cecum. So the cecum is the first part of our colon that receives liquid food waste from our small intestine. And then we have the transverse colon. So I don't know if you guys can see my, my pointer. Let me see if I can do it here. There we go. So, nope, sorry, it's not working. So if you look at the image, the ascending colon is going up. That starts on the right-hand side. Then you have the transverse colon that goes across the abdomen. And then you have the descending colon that goes down, descending. And then the sigmoid, which is like an S. And then that leads to the rectum. So if you look at the way the food and everything travels through your colon, it actually is a counterclockwise direction. So if you like put your hand on your tummy and go in a counterclockwise direction, that's kind of like the way that your food travels through the large intestine. And sometimes you can actually feel it traveling through. So that's what we're going to talk about today. So when we're talking about colorectal cancer, this is the anatomy that we're talking about. We're not talking about the small intestine. We're not talking about the stomach. It's the large colon. And as far as the large colon, it's about 5 feet long. And when I'm 5'1", so when you see me at the walk on the 23rd, the colon is 1 inch, on average, 1 inch shorter than me. It's about 3 inches wide, and it's very muscular. And I'll show you an image or a little video of stuff going through after this. And it's shaped like a tube. And if you look at the photo on the right-hand side, that's what a healthy colon looks like. So all those ridges, it's all very muscular. And here is the colon in action. So let me just click on this. So you can see that the colon takes the liquid food waste or chyme. That ball is called chyme. That's sent from the small intestine and forms it into stool. In order to create stool from this liquid waste, it has to absorb water. So once the colon receives this liquid waste from the small intestine, it takes about 4 to 6 hours to absorb the water and form stool. So this is another reason why we always push drink water, because it helps that process. And on a typical day, our colon absorbs 1 to 1.5 quarts of water. But if you're dehydrated, your colon works really hard to maintain that balance. So your body's working around the clock all the time to always maintain that balance so it can perform its best. So when you're dehydrated, the colon has to work a bit harder and absorb more water than it usually does. And sometimes if people struggle with constipation, it's because they're not drinking enough water. So to get a better understanding of the colon, we're going to talk about the four layers. So the mucosa, which is that very first layer, that one is the one that has direct contact with your fecal matter. Um, and then you have the submucosa, which is the next layer, and that kind of helps start to provide structure. The muscularis is where you saw those ridges. That's where that muscular layer starts. And then you have the serosa, which is that outer cap. And it all works together to help. You saw, like in the previous video, the food passing through the colon. So all those layers, all those muscles help get everything through your colon. It passes like a wave. So when we discuss colorectal cancer, it's important to remember that this type of cancer can affect the colon or the rectum. And all of these cancers start or initiate from a tissue growth that's usually harmless or benign, and it's called a polyp. So it's estimated that 30 to 50% of the human population will develop a polyp at some point in their lives. So it's very common. So if these polyps are not detected and removed, they can promote cancer. And it takes about a decade for the cancer to grow from that initiation. So here's another one, and this is actually going to give us a tour of the colon, and you're going to see polyps in here. So there you go. There's a polyp. There's another one. So these polyps look like little trees. So there's quite a few polyps. Here's another one. So as you can see, the polyps come out of the lining of the colon. So there are a couple different kinds of polyps that grow. The first one is called a pendulicated polyp, and that's the one that we just saw. Looks like a little tree. Um, and then the next kind is a sessile polyp, and this one's a little harder to detect during a visual examination. And it looks like a bump on the surface of the rectal tissue or the colon tissue. And colorectal cancer occurs when a polyp is not removed and turns cancerous. As you can see in this image here, the tissue is very red and inflamed, and it looks very different from that healthy tissue that surrounds it. So if this cancer is not treated, it'll keep growing and spread or metastasize. Metastasize means spreading to different parts of the body. So here's a nice visual of the stages of colon cancer. So that stage 0 is referred to as carcinoma in situ, which means that the cells are abnormal. They've been found. Sometimes doctors will refer to them as precancerous because they're not cancer yet, but if nothing's done, they will grow into cancer. And then in stage 1 through 3, the cells are cancerous. They're growing. They're starting to get bigger and grow through the tissue. So if you notice in stage 3, we're seeing that the cancer is now starting to get closer to the lymph nodes and the blood vessels. And that's the green lines and the red lines that you see in that diagram. The green is your lymph system and the red is your vascular system. So what happens is in stage 3, it's starting to pop into those. And then when you look at stage 4, this is where the cancer has metastasized. It's traveling to different parts of the body. And you can see that it's kind of blown off of the serosa, which is that final layer of the colon. So it's jumping out of there, and then that's when it can move to other parts of the body. So we call colorectal cancer a silent killer because a lot of times it's not diagnosed in until it's in later stages, in stage 3 and stage 4, where, as you saw in the previous slide, that cancer has already progressed. Unfortunately, sometimes the symptoms aren't as clear. And if you look at some of these symptoms, they're fairly easy to ignore. Fatigue. I don't know anyone who isn't tired. Bloating, abdominal pain. A lot of times we will kind of dismiss those. Maybe we ate something. I know I bloat in the heat. So, like different things like that. Or if you eat something, you eat too much, it's easy to dismiss those. But the two that I like to point out that are really important signs, changes in stool. So if your stool changes all of a sudden, that's a great time to start talking to your doctor about perhaps getting some kind of screening. You saw in that video the polyps poking out. So what happens is, as you're going to the bathroom, those polyps are changing the size of your stool. So if you notice that your stool has gotten a lot thinner, that is an indication that you may have to have a conversation with your doctor. Also, weight loss. And I like to mention this for any kind of unintentional weight loss. So unintentional means that you're not dieting, you're not changing anything, you're doing your normal, you're eating your normal way, but you're losing a lot of weight quickly. That is an indication that you should also speak with your doctor. For colorectal cancer, it is a sign, but it could also be a sign for some other illnesses. So the changes in stool and the weight loss are really signs and symptoms to pay special close attention to. And when we talk about metastasis, generally cancers that develop will generally go to the organs or areas that are closest first. So with colorectal cancer, when it metastasizes, and again, that means when it goes to other parts or travels to other parts of the body, the liver is 80% of the time the first organ that it goes to. And then other organs can include the lungs and also your bones. 30% of the time it can go to your bones, 50% to a lung, but your liver about 80% of the time. And what are the risk factors for colorectal cancer? So age is the first one, and age is a risk factor for all cancers. It's just as we get older, more of our cells are being replaced, so more opportunity for mutations. So that's why age is always going to be a factor. Um, and with your rectum and your colon, that tissue is replacing itself constantly. That's an area where you're always getting that tissue, the cell turnover. So there's more of a chance for mutation. There's also certain genetic syndromes that can increase your risk. If you suffer from inflammatory bowel disease or Crohn's disease, that can also increase your risk. And finally, family history can also increase your risk of colorectal cancer. And for family history, we're always looking at first-degree relatives. First-degree relative is a parent, a sibling, or a child. So if there's a history of a parent or a sibling that had colorectal cancer, you might want to get screened a little bit earlier. So there we have it. So if you have a first-degree relative with colorectal cancer, your risk increases 2 to 4 times. If your family member was diagnosed at an early age, the recommendation is that you get screened 10 years younger or as soon as possible before the age when your relative was first diagnosed.